Millions face serious illness each year. Many suffer needlessly. They lack access to a fundamental aspect of healthcare, palliative care. This specialized approach focuses on relieving suffering and improving quality of life for those with serious illnesses. Despite its importance, palliative care remains vastly underutilized and misunderstood globally. This is not just a medical issue, it's a human rights issue. Everyone deserves access to compassionate care, especially when facing a life-limiting illness. The World Health Organization recognizes palliative care as an essential component of universal health coverage. Yet, millions still lack access, highlighting a pressing need for change. The reasons for this disparity are complex, ranging from limited resources to a lack of awareness. We must address these challenges head-on. Improving access to palliative care requires a global effort, with governments, healthcare providers, and individuals working together. We have a moral imperative to act. By understanding the benefits of palliative care and advocating for its integration into healthcare systems, we can create a world where suffering is lessened and dignity is preserved. This is not just about extending life, but about improving the life we have. Palliative care is often misunderstood. Many associate it solely with end-of-life care. While it plays a crucial role in those final stages, its scope is much broader. It encompasses physical, emotional, social, and spiritual support for patients and their families from the point of diagnosis of a serious illness. This approach recognizes that serious illness affects every aspect of a person's life. It goes beyond simply treating the disease to address the multifaceted needs of the individual. Pain and symptom management are paramount, ensuring comfort and improving quality of life. But palliative care is not just about physical comfort. It recognizes the emotional and spiritual distress that often accompanies serious illness. Trained professionals provide counseling, support groups, and spiritual guidance to help patients and families cope. Moreover, palliative care acknowledges the importance of social support. Social workers connect patients and families with resources, navigate complex healthcare systems, and offer practical assistance. By addressing the holistic needs of patients, palliative care empowers them to live as fully as possible. Studies consistently demonstrate the positive impact of palliative care. Patients receiving palliative care report improved pain and symptom management, leading to a better quality of life. They experience reduced anxiety and depression, feeling more equipped to cope with their illness. Families also benefit significantly. Palliative care provides crucial support, helping them navigate the challenges of caring for a loved one with a serious illness. This support extends beyond the patient's lifetime, aiding families in bereavement and reducing the burden of care. Furthermore, research shows that integrating palliative care early in the disease course can improve clinical outcomes. Patients receiving early palliative care often have lower healthcare costs, fewer hospital admissions, and may even live longer. The benefits are undeniable. Palliative care improves quality of life for patients and families, enhances clinical outcomes, and can even reduce healthcare costs. It's not just about adding days to life, but about adding life to days. Despite its benefits, access to palliative care remains shockingly unequal worldwide. Millions lack access to even basic pain relief, let alone the comprehensive support palliative care provides. This disparity is particularly stark in low and middle-income countries. According to the WHO, over 56.8 million people require palliative care each year, with nearly 78% residing in low and middle-income countries. However, only a fraction receive it. This inequity is unacceptable. Multiple factors contribute to this disparity. Limited resources, a lack of trained healthcare professionals, and inadequate infrastructure all play a role. Additionally, misconceptions about palliative care, including equating it solely with end-of-life care, hinder its integration. Addressing these disparities requires a multifaceted approach. We must prioritize palliative care in national healthcare policies, invest in training healthcare professionals, and educate the public about the benefits of this essential service. We must bridge the gap and ensure everyone has access to quality palliative care, regardless of where they live. The urgency for early integration. A paradigm shift in healthcare. Integrating palliative care early in the disease trajectory is crucial. Waiting until the final stages of an illness to provide palliative care limits its effectiveness and perpetuates the misconception that it is solely an end-of-life intervention. Early integration allows for a more proactive and holistic approach to care. Patients benefit from timely pain and symptom management, emotional support, and advanced care planning, improving their overall well-being and enabling them to make informed decisions about their care. This shift in approach requires a change in mindset within the medical community. Healthcare professionals must recognize the value of palliative care throughout the disease course, not just at the end of life. This requires education, training, and a commitment to collaborative care models. Early integration also empowers patients to actively participate in their care. By openly discussing their goals, values, and preferences, patients can make informed decisions that align with their wishes, fostering a sense of control and dignity throughout their illness journey. Palliative care as a human right, ethical and moral imperatives. Access to healthcare is a fundamental human right. This right inherently includes access to palliative care, ensuring that everyone has the opportunity to live and die with dignity, free from unnecessary suffering. Denying access to palliative care violates this fundamental right. It perpetuates inequity, allowing those with resources to access quality care while those without suffer needlessly. This is morally unacceptable. We have a moral obligation to ensure that everyone, regardless of their socioeconomic status, geographic location, or illness, has access to compassionate and supportive care. This requires a commitment to social justice, advocating for policies and practices that prioritize equitable access to healthcare. Furthermore, providing palliative care aligns with our shared humanity. It reflects our empathy and compassion, recognizing the inherent dignity of every individual. By easing suffering and promoting quality of life, we affirm the value of every human life. The economic case for palliative care. Dispelling misconceptions. Some argue that palliative care is too expensive, especially in resource-constrained settings. However, studies have shown that palliative care can actually reduce healthcare costs. By managing symptoms effectively and preventing unnecessary hospitalizations, palliative care reduces the overall financial burden on healthcare systems. Furthermore, early integration of palliative care can lead to more cost-effective care by facilitating informed decision-making about treatment options. This can prevent patients from undergoing aggressive and costly interventions that may not align with their goals or improve their quality of life. Investing in palliative care is not an expense. It's an investment in a more efficient and humane healthcare system. By shifting from a solely curative approach to one that encompasses palliative care, we can create a more sustainable and compassionate healthcare model. Moreover, the economic benefits extend beyond healthcare costs. By supporting families and caregivers, palliative care helps maintain social and economic productivity. It enables families to continue working and caring for their loved ones, reducing the overall impact of illness on society. Overcoming barriers. A multifaceted approach to improvement. Improving access to palliative care requires addressing the multifaceted barriers that exist. This includes tackling misconceptions, building capacity, and advocating for policy changes. A comprehensive approach is essential. Education and awareness campaigns are crucial to dispel myths surrounding palliative care. We must clarify that it is not just about dying, but about living well with a serious illness. Public engagement is key to shifting perceptions and fostering understanding. Building capacity within healthcare systems is equally important. We need more trained palliative care specialists, including physicians, nurses, social workers, and psychologists. This requires investment in education and training programs, particularly in low-resource settings. Finally, advocating for policy changes that prioritize palliative care is essential. Governments must integrate palliative care into national healthcare policies, ensuring adequate funding and infrastructure. They must also implement regulations that support the ethical and equitable provision of palliative care services. Investing in the future. Building capacity for sustainable change. Long-term solutions require sustainable investments in palliative care infrastructure. This includes establishing specialized palliative care units within hospitals, developing community-based palliative care programs, and integrating palliative care into primary healthcare settings. Training healthcare professionals across various disciplines is crucial. This includes equipping doctors, nurses, and community health workers with the skills and knowledge to provide basic palliative care. Such training should be integrated into existing medical and nursing curricula. Furthermore, we need to invest in research to advance our understanding of palliative care and develop innovative approaches to care delivery. This includes exploring telehealth and mobile health technologies to expand the reach of palliative care services, particularly in remote and underserved areas. By investing in infrastructure, training, and research, we can create a robust and sustainable palliative care ecosystem. This will ensure that future generations have access to compassionate and supportive care when they need it most. Technology and innovation, expanding the reach of palliative care. Technology offers innovative solutions to bridge the gap in palliative care access. Telemedicine, for instance, allows for remote consultations, bringing specialized palliative care expertise to underserved areas. This is particularly valuable in rural communities with limited access to healthcare professionals. Mobile health applications provide patients and families with valuable resources, including symptom trackers, medication reminders, and educational materials. These tools empower patients to manage their symptoms effectively and communicate their needs to healthcare providers. Artificial intelligence, or AI, is also emerging as a powerful tool in palliative care. AI algorithms can analyze large data sets to identify patients who may benefit from palliative care, predict symptom trajectories, and personalize care plans. By embracing technology and innovation, we can overcome geographical barriers, enhance communication between patients and providers, and improve the overall efficiency and effectiveness of palliative care delivery. A call to action: collective responsibility for global access. Improving access to palliative care is not just the responsibility of healthcare professionals or governments. It requires a collective effort. We all have a role to play in advocating for change and supporting initiatives that promote access to this essential service. Individuals can make a difference by raising awareness about palliative care in their communities, volunteering at hospice or palliative care organizations, and advocating for policy changes that prioritize palliative care. Healthcare institutions can prioritize palliative care education for staff, integrate palliative care into existing services, and collaborate with community organizations to provide comprehensive support to patients and families. Governments and policymakers must enact legislation that recognizes palliative care as a human right, allocate adequate funding for palliative care services, and develop national strategies that ensure equitable access to quality palliative care for all. Together, we can create a world where everyone has access to compassionate and supportive care when they need it most. Finally, imagine a world with dignity and compassionate care. Palliative care is not a luxury, it is a fundamental human right. It reflects our shared humanity, recognizing the inherent dignity and worth of every individual. By providing compassionate care and alleviating suffering, we affirm the value of life, even in the face of serious illness. We must move beyond the misconception that palliative care is only about dying. It is about living well, finding meaning and purpose, and receiving the support needed to navigate the challenges of serious illness. It is about ensuring that individuals and their families feel supported, empowered, and heard throughout their illness journey. The global disparities in access to palliative care are unacceptable. We must work together to bridge this gap, ensuring that everyone, regardless of their socioeconomic status or geographic location, has access to this essential service. By investing in palliative care, we are investing in a more just, compassionate, and humane world. We are creating a world where individuals facing serious illness can live and die with dignity, surrounded by the love and support of their families and communities. This is the legacy we must strive to leave behind. Thank you for watching. If you enjoyed this video, please give it a thumbs up, and don't forget to subscribe to the channel for more content like this. Hit the notification bell so you never miss an update. Leave a comment below with your thoughts and any suggestions for future videos. See you in the next video.